Alright, today I'm going to do a manual ventilation. So what I'm going to do is just with an AMBU bag today. And so before I ever begin doing an AMBU bag, I always need to check the charts, make sure I see anything that I may need when I go into the patient's room. So when I enter the patient's room, I always need to make sure my hands are properly clean and sanitized, and then I'd always make sure they're dry and apply the proper gloving. And if I see that the patient has any injuries, something that can splash up on my face like blood or anything, I need to wear a face protection, or even if I feel like there's something pretty bad, I can always wear a gown as well. So when doing a manual ventilation with a AMBU bag, I need to find the proper fitting size. So here I have a medium size. This one is too small because it does not fit over the bridge of the nose to the end of the mouth, and so I need a bigger one. So here I have a large size AMBU mouthpiece here, and that can fit over the mouth and the nose. So as long as it fits over the bridge of the nose and the mouth, that I'm able to, when I do my C shape, I can get a tight seal around the mouth. So when I hook up the AMBU bag, I need to hook it up to my oxygen source, so I'll hook it up to the nipple adapter here. And then I need to turn it to 15 liters per minute. And before I ever give the oxygen to the patient, I always need to make sure this bag stays inflated. And I can have my mask ready to go, like this. And when I go to do a manual ventilation, I always need to take and check the breath sounds, and I need to see how they're breathing, if I need to do along with their spontaneous breathing, anything like that. So when I am ready, I need to place it on the bridge of the nose and over the mouth, and then I need to cup it with my hands and make sure I get a tight seal around there. And I need to do a chest, tilt the chin, and then if I need help, I can always have somebody do a modified chin jaw thrust or something like that to help me get the proper breaths in for them. So I need to do 12 to 20 breaths per minute. So when I have it, I should be able to get a tight seal and be able to give enough oxygen to the patient. And I always need to watch this bag back here, because if this deflates, I always need to make sure it reinflates. The reservoir bag needs to reinflate, so that way I get the proper amount of flow to the patient. So when I am done, I will remove the mask. If it's a disposable mask, then I would dispose of it in the proper place. And then I would shut off the AMBU bag down to 0 before I remove the cord. And then I'd set it in a safe, clean area. Then I'd reassess the patient, and I'd also apply any oxygen to the patient if I would need any, if they need more oxygen. I'd check their SpO2, check their vital signs, and record how their breath sounds and if they are breathing in a better manner, they're not breathing spontaneously anymore. And then I would chart everything in the patient's charts, wash my hands, remove any PPE that I may have on, my face shield before I leave the room, wash my hands, and make sure things are charted.